Hello guys, welcome back again to my YouTube channel. So this is Paulo Bridge, your Pinoy nurse here in Singapore. So for my today's content, guys, it's all about sharing. I'm going to share to all of you my journey of being a nurse here in Singapore. I believe this content I already made before, but it's in Tagalog version. But now it's going to be English version. So for those subscribers, those my follower who cannot understand Tagalog, so stay tuned. So before that, don't forget to like, share, and subscribe my channel, okay? So the purpose of this content is for you to be inspired, and also, at least you will know my journey, how I become a nurse here. And I think my journey is quite difficult, and most of my friends managed to experience this journey, okay? So let's get it on, okay? Year 2010, I came in Singapore, December 2010, to find a job, of course. And that time when I came in Singapore, I don't have really nursing experience way in the Philippines. So I think I do have only like less than 7 months, I believe so. But due to I need to work and I need to earn money, so I go in Singapore to find a job. So that time, I just walk in. I try to apply in a big hospital like acute hospital, then community hospital. So that time when during I'm trying to apply, it's really difficult to get because since I don't have experience at all. So I reached to the point that I already like how to say it, I already give up and try other fields such as food and beverages. So I apply in Coffee Bean and in a Japanese restaurant. So that time I actually I managed the interview in that Japanese restaurant, but when they asked me to cut the cabbage, then I failed the I failed already, so they didn't hire me. So I think that is a blessing in disguise. So my last resort was to apply in nursing home. So that time I submit all my application in nursing home. Then yes, I managed to get one. But the thing is that nursing home, the person who I managed to talk to, she still submit my application to the agency that she knows. So end up, instead of being employed in direct hire, I went to an agency. So that time, year 2010, I think year December 2010 until January 2011, the application, the processing, it cost 2,500 for me to get, you know what position. Since I don't have experience, the position they are offering me is nursing aide. So nursing aide with a basic salary of how much? $380 plus shift allowance of $30. But the accommodation is free. So that is the offer. So since that I really need a job and I really need to earn money, so I grab it. Even the processing of the agency is 2,500. So the work visa that they are planning to give me is work permit. So having said that, I need to exit in Singapore because as I understand, work permit visa, you cannot this visa they cannot process it if the person is in Singapore. So I need to go to other country, like either I need to go back to Philippines or Malaysia. But if I go back Philippines, then it will be quite troublesome. So I intended to go to exit to Malaysia instead while processing my work permit. So yes, the application was smooth, so I managed to get work permit. And yeah, I started working in this nursing home February 2011. And I think in this nursing home, my length of service is from 2011 to 2016. So I can consider like 11, 12, 13, 14, 15, 16, 5 years. So during that 5 years, I really work hard, and I really fight for my promotion that time, because that time they don't really promote, the promotion is really slow, and they don't really promote, some of the staff get promotion, but that branch, I am the first, I think my batchmate, I am the first Filipino who got promoted from nursing aide to enrolled nurse. But for me to get that promotion, I really fight back. And I did not really fight back, but I highlighted to the management or HR. Then after that, slowly, some of my friends get the promotion as well, because that time they really don't want to promote. So yes, I managed to get the enrolled nurse post in nursing home. So I needed to suck it up and everything, all the things that you think. That's why I have this content before, like all around nurse. So some job scope is not included already in nursing, but we still do, especially in nursing home, cleaning the toilet, cleaning the ward, working in the kitchen. So this is the thing that nursing aide do in nursing home before. But yet I didn't hold any grudges. So I think that experience makes me more stronger. But after I get the enrolled nurse post, I told myself, because I wanted to get staff nurse post, but I think that time it will take one more year to get the staff nurse post. So I decided to go to community hospital or any hospital. At first, I want to go to acute hospital immediately. But if you're from nursing home and you will go to acute hospital, that time they won't take you. So I end up go to a community hospital. So I started working in this community hospital from 2016 until 2022. 16, 17, 18, 19, 20, 21, 22. Wow, almost 6 years lang. 6 years. So in this community hospital, managed to work for 6 years. So yeah. So when I joined this community hospital, of course, I cannot get the staff nurse post. I end up, my position is enrolled nurse. So I try to work hard again, work hard, so that I can get the promotion and to get the staff nurse promotion. So the thing is, I cannot forget this. I cannot forget because that time, I think after 2 years, my manager really want me to send to staff nurse examination. So, but the thing is, someone hold my promotion, and I was being marked, being playful and everything. But I appreciate my manager that time. She really fight for my promotion, and yeah, I managed to get the promotion after 3 to 4 years. I forgot. Oh, I managed to get the staff nurse post 2019. So this type of politics and everything is always there. So you just need to be like, your heart must be thick. And I'm not saying you must always fight for your right. Also, you need to reflect what is your mistake and everything. But I also struggle for this promotion. So, but end up, luckily, my manager really helps me to get this post. And yeah, I managed to get the staff nurse position year 2019. So that time, I decided to stay in this community hospital. But the thing is, actually, I believe in myself. I'm very ambitious, in a good way, or I don't know how they will take it, but yes, I'm very ambitious. So after I get this staff nurse post, I asked them if they can send me for study. So actually, this community hospital, they will send their employee for study, like example, advanced diploma, degree, or specialist diploma, something like this. So I apply for advanced diploma, so that I will learn more. So, but I end up, I didn't get it. I think they still the stereotyping is still there, so I didn't manage to get the study. So, but I think I decided to move to acute hospital instead, because my thinking is the time, like, since they don't want to send me in study, instead of staying in community hospital, I better go to acute hospital so that I will learn more. So I'm not saying in community hospital you will not learn anything, but the workload from community hospital and acute hospital is different. And I'm thankful also with my experience community hospital, because it prepares me on my this current workplace where I'm working now. So because of that experience, I managed to cope fast. So yeah, that's the story. That's the reason why I resigned in this community hospital. Then I currently working in acute hospital here in Singapore. So by the way, guys, I've been receiving some comment that where do I work. Of course, I think I mentioned this before. I cannot tell you where I work and everything, because of course that is confidential. So I think that's it. After I resign, I joined this acute hospital, quite big. It's a government institution, year 2002 until now, until present. So my position still staff nurse, and I believe my I'm enjoying it, and I've learned a lot. But of course, work politics is there. I'm telling you, I'm not saying that I'm currently happy on my workplace, but somehow it fulfills my goal to learn more, which is I enjoying it because I'm learning a lot of things in this hospital. But to tell you honestly, I don't think I it fulfills me in. I mean, of course, lah, I'm not expecting that 100% this company will give everything that I want. So I think that's it. But yes, I'll still working in this acute hospital, and I think I'm grateful for this job. And of course, I'll just need to work hard again to get promotion and everything, lah. So I think that's the journey for my nursing journey here in Singapore. So for those who for those who doesn't know, we always call this journey as like a bridging program. I think one of my friend told me this is the bridging program. Bridging program because we started from nursing aide, then get the enrolled nurse, now a staff nurse. So it really takes many years to get this staff nurse post. But I think it depends also. It depends on your luck. It depends how good are you, because some they can even reach to managerial position. So I think I have one. I know some that like 14 years only in Singapore. They started from nursing aide and now they are manager, but they stay on the same employer, so they managed to get the manager position. And also some like every 2 years they get the promotion. So there's a pros and cons also if you keep on jumping. I mean, if you keep on changing your employer. But as you can see, guys, my experience, I'm quite proud with my experience, because I went in different healthcare institutions such nursing home, community hospital, and now acute hospital. But and also I was trained, most likely I'm more exposed in geriatric, taking care of elderly. Currently now I'm working in general medicine, but most of my patient also is geriatric, but it's not a geriatric ward, it's general medicine, which is I like, because since when I was studying, I think I'm excelling in medical surgical. So yeah, so my tips, guys, just continue your hard work, and of course perseverance, patience, and everything. There's always a reason why things haven't happened yet. Maybe it prepares you to something bigger. And also, if you think in yourself that you're not happy anymore, then move. But before you move, highlight to your management, to your boss, why you're not happy, how can you improve and everything, lah. I mean, I'm not saying you immediately resign, but it's better to be outspoken. I think that's my behavior. But some they prefer to be quiet and just go. But you need to communicate also. At least they will know how what they will offer to you. But sometimes even you communicate with them and you're not happy of the things that they will offer to you, then just go and resign. But if you really want to, especially if you started in nursing aid or enrolled nurse, I cannot promise you when you can be get the promotion and everything. And those who started as staff nurse, of course, I understand that your experience in your home country or overseas is very good. That's why you get this staff nurse post. So yep, you need to just to work hard and try to cope fast. I think that's it. And thank you for watching my content. And I hope this content not so lengthy. And I appreciate for those who finish entirely finish this content. Okay, so I think that's it. Thank you for watching and bye bye.